Welcome to the office.
Hi.
Hi.
Welcome to the office.
Thank you.
What brings you here?
Lots of things.
Like?
I turned 52 and everything started hurting. Hurt my knees.
Typically that doesn't happen, guys. It's not like you turn 52 and things start hurting, okay? It can happen at any age.
No.
All right.
So I had, when I was younger, I played a lot of volleyball. I had all kinds of neck, back,
What
knee
position?
pains, libero and setter.
Got it, okay.
So
You all
dove
know
a lot
that,
of balls,
mhm.
for a lot of balls and things. And but you know, through my 20s and 30s, the pain just dissipates and goes away.
Of course.
Yeah.
So, volleyball,
Volleyball.
I'm sure multiple injuries.
Multiple injuries, yeah.
Anything, any hospitalizations from any of that in school?
No hospitalizations, but
Bed
emergency rooms.
Emergency room.
Major sprained ankle.
Right side?
Right
sprained
I think
ankle?
it was the right one.
Okay.
But you know, probably 2,000 sprained ankles over the course of playing.
Sure.
Um,
But what's number one?
number one?
Number one issue? Your back?
My
Low-
back.
Low back.
My low back, yeah.
Okay, and this started back in high school playing, or this
Oh.
happened more recently after
No,
50?
back in high school, probably, yeah.
It did start. No, I'm saying the pain, like.
Oh, back in high school. I used to go to a chiropractor in high school too.
Oh, okay.
And then I think, yeah, it's just, I mean, I played probably 4 or 5 days a week.
Nice. Okay. So number one is the back.
Back, neck.
Any shooting pains down the leg?
No shooting pains, just dull, achy pains all the time.
All day?
All day.
More in the morning, more at night?
I can't really decipher. It's just always achy.
It's always there?
Yeah.
Nagging.
If I start hiking or walking or what have you, it tenses up pretty within the first 10 minutes.
Okay, so walking makes it worse.
Walking makes it worse.
What makes it better?
Stretching.
How is it affecting quality of life?
Well, like I said, I went to South Dakota this week, and
Okay.
my walking is limited. I mean, I do it. It usually starts making my ankles hurt a lot. The bottom, my heels, and my
Starts at the ankle, starts the back gets tight first.
the back gets tight first, and
Okay.
then I start probably adjusting how I walk, and my ankles always feel they get the worst of it.
Okay. What else?
I have a torn meniscus and some arthritis in my knees.
Okay, right side.
Right side is the torn meniscus. There's
Lateral,
3 tears.
medial.
I don't know. There's 3 of them, and I don't remember.
Radial tears.
I don't remember.
Okay. Do they go this way or this way?
1 goes this way, 2 goes this way.
Okay. So
That I remember.
This way versus this way.
I'm a pointer.
Okay. No worries. And it's on the outside one you said?
It's on.
The
I think there's one right kind of in the middle, and then there's one here and one here. I
No,
believe.
but there's a lateral meniscus and a medial meniscus.
Oh.
So you're saying you have 3 tears on one meniscus?
I don't know.
Okay. Well, we need to know. So maybe you can bring me that report.
Okay.
Sound good?
Yeah.
Okay. All right. Neck. Shooting
Neck.
pain down the arms.
No shooting pain. Sometimes they start to get tingly and numb, and I have to adjust how I'm sitting
Okay.
or laying. I get a lot of like my neck gets very stiff and kind of stuck.
All day?
No, just like if I'm laying in a position for a while, or if I'm on the plane and leaning, before I can actually move, I have to kind of like little movements before I move.
Understood. Okay. And you're working right now?
Uh-huh.
Are you moving or are you
I
moving
do-
around or do you sit?
I do structural engineering, so half my time is
nice.
sitting,
Right
my
on.
other half is climbing on rocks and
Oh,
mountains.
so you get all this? You get all this work, huh?
I get how
think
it
so.
fits together.
Yeah, you kind of, all right. It's cool. I like when we get, yeah, it's good, because this is all engineering principles, so you can correct any of my terminology if I'm wrong.
Well, I'll stick to structural engineering.
I mean, this is structural engineering, is it not?
Yeah.
Okay.
I guess it is.
All right. Okay, so we have back, we have ankles, we have knee. We're not dealing with till I get a report. We may have to take X-rays on it if we don't have anything. If we have, you don't have anything.
I have an MRI, and I was trying to
X-rays.
find it before I left. I don't have a copy of the X-rays, but they did take
You were
X-rays.
standing or lying down?
I was lying down for the MRI. I was standing, I think. For
If you were standing for the X-rays, I'll take those. If not, then I'll need to do my
Okay.
own. Okay, but we're not there right now.
Okay.
Okay, because there's some fun stuff we need to go over.
Okay.
Okay. All right, so that's a good start for us.
Yeah.
Yeah. Okay. What we'll do? Let's go over your X-rays. let me explain what I see. We'll do our exam, figure out where we're gonna start together.
Okay.
You got questions, you ask.
I will.
All right?
Yeah,
You
absolutely.
uncomfortable? Call Shasha.
Okay.
All right? All right, this is you. This is a picture in time.
Mhm.
Tells us how you've evolved from birth, right? 24 bones in the spine that move, 23 discs in between. This is looking at you from behind.
Okay.
And to answer a question someone asked, why are you looking at x-rays backwards? We're not. Chiropractically, when we look at a full spine, we look from behind. When they're doing medical scoliosis evaluations, they look from the front. So this would be turned the other way, where right, like you're looking at the person head on, right? So looking at you from behind, we can see some pelvic or foundation imbalance.
Mm-hmm.
We can see some curvature stuff going on here, and we'll go through that. On your side profile, okay, this is interesting. On our side profile, we're looking at posture, we're looking at disc, we're looking at curves. The first thing we want to see is, do we have the right posture? And we're going to run this line up from the lowest lumbar, which is your L5 in the center, right there. It should bisect 7 and 2. So yours goes okay. I mean, it's close enough on the bottom.
Okay.
But
For a 52-year-old?
no, just in general. But what happened is we have what? We have some anterior head carriage.
Okay.
So it's about 14 degrees of anterior head carriage. For every 1 degree past neutral, what the research shows, it's like we're carrying an extra 10 pounds on the lower cervical spine.
Okay.
So you carrying 140 pounds on your neck, on your
Jesus.
shoulders, just sitting in, right? Sitting and
Wow.
standing a long time.
Okay.
All right, so that's, and we'll go into more of that detail later, okay? I just wanted to give you an overall. Curvature-wise, we are designed to have 60-degree reciprocating curves. So I'm going to move that out of the way for a second, and that we should have a forward curve this way, forward, backward curve this way, forward curve this way.
Okay.
This should be 60, 60, 60, some say 40, but
60 is measured from the vertebral?
the arc.
The arc. Okay.
The arc. So we should have a 60-degree arc going forward, and again, it could be 40 to 60 in the neck, 60-degree in the mid-back, 60-degree in the forward and the low back. And that's what the research shows, that's what the biomechanics talk about, biomechanists talk about.
Okay.
Now, when we look at yours, you have a pretty straight spine.
Okay.
I don't see a lot of curve in here. It goes straight, and then what happens here, you're actually developing the reversal of the curve.
Okay.
And we'll talk about those consequences also. Now let's get back to this. There we go. Let's look at her foundation. So 24-story building. In order to have a stable building, we need a level base and foundation. All right, so let's look at her foundation. Do we have a level base and foundation? We're a little bit off, a little bit tilted. Sacrum is definitely tilted, but you had a major trauma here, dude. I'm trying to figure out, this is all trying to fuse and calcify this piece here. You also have what's called spatulation of your left transverse process of L5, which is forming an accessory joint with your sacrum on the left. That's why that left is so stiff.
Okay.
That left is stiff. And if you're not moving a long time, you're sitting a long time, I'm sure it's the left that gets really stiff. And I'm talking about deep in the joint.
Yeah, that's
there.
usually where I feel it.
And that is the accessory joint. Now, I may have some old videos on some of these accessory joints. There's no fix for this.
Okay.
Meaning, let me be clear about it. There's no surgery for it, not that I'm aware of. There's no, I'm going to adjust you and the accessory joint disappears. That's just,
It's just there.
That's your norm. The key is to keep it moving, but you see, because it's tilting down so far, right, we need to get that out opened. So if we're looking here, I can't wait to give any miles. Okay, if we're looking at it here, let's say that's the tail of the sacrum, okay? So what's happening is this transverse here is going down and fusing to that. And that's the
so
tail.
So it gets stuck that way?
It's getting stuck. So there's ligament, right? There's connective tissue. So the idea is we need to make sure your pelvis is moving correctly, number one. Number two, we got to figure out what's going on with this L5, because you have an accessory joint here, and then it's trying to fuse to your L4 here.
Okay.
And I'm still trying to figure out what the heck you did, lady.
I fell once on my tailbone in Switzerland.
Okay.
rug from a rug. I was running across the hotel lobby and
Yeah. It's a big, it's all kind of fusing together there on the right side. Okay. So there's your tailbone injury right there. Okay. There. L5 is off. 4. So this is really the thing we need to sort out. We need to sort out your sacrum, tailbone. Then we need to figure out this 5.
Okay.
It's going to be spicy.
Okay.
I'm just letting you know. You like spicy? You can eat it,
I don't
though,
like
right?
spicy.
You don't like spicy? Okay. You don't like spicy now. All right. Let's continue on. So let's get to the numbers too. Let's look here. All right. So we have a tilted sacrum. We have an accessory joint here, and we have some sort of calcification of L4 and L5. Let's go to the numbers and see what the numbers tell us. And here's some answers. There you go. That's your tailbone injury. Okay, so we have a rotated sacrum on the left side, drop down 6 millimeters.
Okay.
That's your injury that started, but we also have an AS pelvis. I'll explain it. We have 2 millimeter measured difference. So right now your left hip is 2 millimeters lower than your right.
My left is 2. Okay.
So you're tilting that way, but your sacrum is 6 millimeters drop, so the whole thing is dropping. Now,
it's like pizza.
Huh?
It's like the entire pizza.
I think you almost got the same angle too. So you got a measured difference of 2 millimeters on the left. AS7, PI7 on the opposite. So what is that telling us? Left side is actually up the pelvis.
Okay.
The sacrum is back and down. Okay. So the disconnect is that left side. Now, if I adjust the left pelvis and I bring it down, it's going to make the leg length discrepancy more.
Okay.
But 6 millimeters of it is coming from there. So let's say we did do that, right? Let's say, I'm just giving hypothetical. Let's say we worked on that, it went to 5, and then we worked on the sacrum, went up. That's in a perfect scenario.
Okay.
Okay. In your scenario, if we have an AS pelvis with a rotated sacrum on the side, the book says to do the sacrum. We'll figure it out on you. I probably would agree with it. I see a lot of tilting of the tailbone coming from around S3 right here.
Okay.
This is level, this is the tilt. So S3, maybe S4. We'd start on the tailbone a few, get it going, probably work on the pelvis a little bit with it, and figure out kind of visit by visit what we need to do there. Okay? Now, from there you can see the drop sacrum causes this curvature to the left side.
Come back.
Yes. Okay. This is all gas and undigested food in the colon. We will talk about and deal with your digestion while you're here. If you'd like me to, you're in for a big treat. You're in for a big treat today. All right, let's continue on. So that's going to be our major. All this gas, undigested food. Megan Blasi is there, but small. Now, we have...
What's a Megan Blasi?
Megan Blasi is the gastric air bubble. It should be a big black half circle this big. Okay? Yours is somewhere in there. But you have a lot of fermentation, a lot of undigested food, so you're not absorbing and assimilating as well as you should.
Okay.
And the idea with that is what? Get the stomach acid going. We can look at it from neurologically, from the mid-back and the upper cervical. But at your age, since you like to talk about your age, I'm going to probably start you on a supplement to speed up the process.
Okay.
T1, 2, 3, 4, 5. T5 is a side slip. T6 is tilted 7, 8, 9, 10. 10. Okay, this is interesting. So the curve goes like this, and then it does what? It immediately goes back, right? Interesting. Hold on, that threw me off. She's gonna make me work here, guys. I'm gonna actually do some work here. Alright, so if we take that, go up, I'm gonna try something here. There's our sacral baseline, okay? Now, let's take that up. Let's say we were level here. Yeah?
Yeah.
That's level?
Yep.
Pretty good. Let's follow it up. And let's see, does it level there? Nope.
No.
Let's find the level. Right there. Nope.
No. A little bit higher. There.
Are you sure?
No. No, that got worse.
I'm going to say there because look, that's the line.
Uh-huh.
It's 12, 11, 10. So tailbone to there, this is all compensation we don't need to mess around with.
Okay.
Then the next one from here, this is level, is this one.
I'm sorry, meaning it'll fix itself when you adjust.
It's
the other
compensating from the
Okay.
misalignment. So in the way Gonstead explained it in the full spine analysis is the first vertebrae that goes off the level foundation is your potential subluxation or spinal shift or misalignment. It can take 2, 3, 4 segments with it, okay, in compensation before it comes back to level again. The next one that goes off, so we go through subluxation compensation through the full spine. Now, in the way he described it, there's usually not more than 4 major subluxations in the body. The rest is compensation. I'm trying to show you right here. Everything here is coming from there.
Mm-hmm.
Look, the whole
That's
thing.
interesting.
The whole thing is tilting.
Yeah.
And where's the tilt coming from? Right there. And what number is that? That is number 12, 11, 10, 9. T9 is also adrenal area. Energy.
That makes sense.
Okay. You get, you wear what, sunglasses?
No.
Sunlight bother you?
No.
You wake up in the morning and you're a go-getter, or you takes
Yeah.
you about a half hour or so?
No.
No?
Get up.
Okay,
Yeah.
cool. All right.
I get tired. I can go, I've always been a like 5-6 hour sleeper
Got
my
it.
entire life.
Got
And
it.
I just get tired at night if I've been running all day. Or if my ankles hurt.
Okay. We have a right jaw deviation, left compensation.
Hmm.
We'll deal with that if we need to. So here's the interesting part here for me. I'm sure we're going to find some stuff up in here. We have a few side slip vertebrae, but what I'm showing you is the fix.
Okay.
9, sacrum, pelvis, and then this thing, look, so it's turning, right? It's
Yeah.
tilting, tilting,
Yeah.
tilting, but then what does it do here again? Goes the opposite way again.
Yeah. Yeah.
That's around T1, C7. Okay, so we have potential we have a potential at C2, C1. We have a potential at the base of the neck, T5, T9, L5, once we sort out her foundation. The numbers tell us sacrum, side profile, let's look at her discs, and this is where the fun starts now. You have a lot of wear and tear. Most of these discs here are all less. That's fine, it is what it is. But I would say they're at least 40% less.
Okay.
Okay? If I want to be very generous, I'll say 35%.
Okay.
Okay? So there's still good discs there, that's good. Thoracic discs are great. They're generally going to be thinner.
Mm-hmm.
And what I see is right there. 1, 2, 3, 4, 5. T5. Okay, let's look at the neck. Looking at the neck, same thing. There was a trauma here. This thing is tilting back. And then we have a disconnect between 2, 3, 4, and 5. You crack and pop a lot up there, I'm sure.
Not anymore, but I used to.
What do you mean not anymore? Like a month ago?
No. I don't do my neck a lot.
Okay.
I used to though, like all the time, 20 times a day.
There's ligament damage right there.
Uh-huh.
Okay, so we want to stay away from that
Okay.
for right now until we do down the road. We'll
Interesting.
figure out.
Okay.
You see the disc? This is
Yeah.
called George's line. You can look it up. George's line is a disruption of the vertebral bodies at the posterior vertebral bodies. So when we run a line down the back of the bodies, we're going to run a line here, here, here. They should all kind of meet.
Okay.
There's a disconnect.
I see.
And that disconnect is indicative of ligament laxity. Okay?
Huh.
Now, let's go to the flexion and extension. So, in extension, and we didn't talk about that whiplash. That was a good injury.
Yeah, I had an accident, a couple accidents.
The good news is your discs are still good there.
Okay.
The bone here, though, there is a little bit of calcification in there going on. You already know all that. And
Is calcification the same as arthritis, or is it two different things?
she's asking me a fantastic question. I love that question. I have a whole video on it.
Okay.
And it's an old video. It's called Dr. Rahim Chiropractic 101. So when I say calcification, the body will lay down calcium in order to stabilize instability. And the way I've described it in the video and the way I was trained, we talk about spinal defense mechanisms. And I'll go in more detail for you guys and make a new video on it. But first line of defense is our spinal curves. We lose our curves. Second defense is the muscular system. It starts to spasm areas that are not stable. Spasms are energetically very expensive. Eventually they fatigue, right? Because too, it's a lot of energy. Third system is the ligamentous shortening. So that's where we get that stiffness, morning stiffness. We go through the day, things get better. End of the day, we're tight. Wake up in the morning stiff. That's the ligamentous system. Third defense. Fourth defense is the disc. Discs start to wear out from lack of movement. And the fifth and final system is the osseous system. That's where the body says, look, lost the curve, muscle spasm, fatigue, ligaments got short, discs started to wear out or degenerate, and finally I'm going to lay down calcium because we need. So calcification or arthritis, I don't like the word arthritis because arthritis is actually not calcification. Arthritis is actually inflammation of a joint. So it's a misnomer.
That's very
it's
interesting.
It's not used correctly.
Okay.
It really isn't, guys. So itis means inflamed.
Right.
Joint. Arthritis is an inflamed joint. That's 6 to 8 weeks. After that, it's arthrosis. Okay, meaning it's been there a while. So what the defense mechanisms I'm describing are the subluxation degeneration model of osteoarthritis. Okay, and I explained it in a lot of detail on this one video. It's a little older. It's a little dingy.
Are you not as funny in that?
I'm kind of serious. I had no white hair back then. All right, I had long black hair, I think. No, but I am talking specifically about osteoarthritis, mechanical wear and tear leading to this. I am not speaking of psoriatic, rheumatoid, or any of these inflammatory arthropathies. This is mechanical.
I understand.
And I have a lot of examples in office of people that were able to reverse it. If we can figure out the stability, this is a mechanical issue, then logically what should happen?
It should start working
because bone is live tissue. Bone is not dead tissue. I just learned something the other day. What's the only part in the human body that doesn't repair itself? Good question. I just learned this yesterday and I thought I should have known this. There's one thing in one part of the body that if it damages, there's nothing you can do.
Your hair?
If I cut your hair, it'll grow back.
Okay.
If I cut a tear in the eye, it'll grow. Good question. Leave a comment, guys. Yeah. Okay. In extension, what happens? In extension, you're going back, fine. In extension, it is binding a little bit more here. This is C2, C3. You get any shortness of breath?
Not particularly.
Breathing is fine?
Breathing's usually fine.
Good.
I do have
allergies?
Like my nose is, I have allergies and my nose is always plugged somehow, one way or the other.
Okay. So in an inflection, they kind of all move forward, but here's what's a little bit off for me. This moved, that moved, even though there's that moved. That one didn't move as well. It's tilted and the facet didn't open as well. And C2 also has a little bit of binding in the back there. But let's see what we find on you, okay? Questions, good?
Good.
All right, you ready to get started?
Yeah.
Let's do it. Walk to the corner of the room and back. She got the Oahu? Oahu wiggle. She got the Oahu wiggle. You can see that left side just shifts with it. It binds and shifts and drops. You see that?
I can feel it.
Yes. One more time, please. All right, let's have some fun. Okay, we'll start by running the meter down the back. This instrument, this is mini thermography. We call it the nervoscope or the neurocolometer or a temposcope, and it's measuring It's a bilateral temperature differential, measuring the difference of temperature at each spinal level. And this is a autonomic test. This is a sensitive test. So the difference between a sensitive test and a specific test. You remember your research days? Huh? False positives and false negatives.
Okay.
Yeah, you remember that? Okay, starting at the base. She's all over the place here. I'm going to wait on the neck, okay? There's just too much activity going on there right now. And where is it, guys? Where is it? There it is. Where is it? It's around T8, T9. And this is all down in the tailbone. We're down in the basement, all right? P, S3, S4. I want to say P3, P4 like the parking lot. It's S3, S4. So we got S3, S4, T9. I'm going to come back to this later, okay? Static palpation. This is all inflammation in the body, okay?
Are you sure it's just not fat?
No, it's not. It's not. 1, 2, 3, 4, 5, 6, 7, 8. You're in for a treat. You'll see what I'm talking about.
Okay.
1, 2, 3, 4, 5, 6, 7, 8. More tender at 8 or 9.
Ooh.
8,
8.
7.
No, 8.
This one.
Yeah.
That one?
Yes.
Well, let's make sure I counted right. Head down, please. 1, 2, 3, 4, 5, 6, 7, 8. It is 8. Let's check the roll back. Back slowly towards me. Back slowly towards me. No, 5. That's 5. That's 1. That's 2. You have a high pain threshold?
Yeah.
That's 3. More tender at 4 or 3. 2 or 3. It's like right when I bring you back, you hold your breath.
Okay.
Stop it.
I will breathe.
Okay? She goes like this. You need to feel it. 5. Now, that's 5.
Uh-huh.
That's 4. That's 5. That's tender, I know, but we're starting down low. 1, 2. That's where I feel
I
it.
think that one.
That's 3. 8. T8, S3. Yes, I feel their pain. Okay. Let's check up top in the neck. I just want to feel it before you adjust. Okay, sit back for me, please. And you said the right knee, correct?
Right knee. I do have a left knee problem too, but that came after.
Right is the major though.
Yeah.
It's a lot of compensation up there. The bones are actually moving. It's your muscles and ligaments that are all tight. Okay, here's our game plan for today. We're going to do T8 and S3.
Okay.
And then we walk after that.
Okay.
After the walk, I'm going to recheck, see if the neck shows up.
Okay.
If it's there, we work on it today. If it's not, we're not messing with it today. Then I'll work on your ankles.
Okay.
Okay, shoulders, elbows, tune up the rest.
Okay.
We're not touching the knee just yet though. Okay?
No problem.
Let's go face down. Shasha. Yes, Shasha. Slide up a tiny bit more, please. There you go. Yes, Shasha. So, we want to torque on the left side. Remember, the left is low. So I want to bring that left sacrum up. You ready? You got her? See? Yeah. Wish it was that easy. That's the home run. Gotcha. Thanks, Shasha. Gotcha. Nice. Hi.
Woo.
A little spicy.
Was it? That lower one was kind of spicy.
A little spicy.
That second little.
Do you need your glasses to walk?
No. I
Okay.
just need to collect myself.
Deep
Ooh.
breath, please. Hold my hand, please. Deep breath. Check it out. Walk 2-3 times back and forth. There you go.
I can feel it like all kind of. Yeah,
Power zone. It's gonna feel a little weird walking.
it does.
Okay? It's been fixed like that for a long time. You sure it's not your glasses? Can we wear the glasses so we don't have
Just in case we
Because I'm
can
gonna have
verify.
somebody say, oh, she's not wearing her glasses after. I'm gonna get that. There you go.
Am I walking?
Yeah, you're walking. You're walking. You're walking.
Oof.
Yeah, you're walking. Keep going. Keep walking. And then have a seat over here, please. Let's retest. Tell me sitting.
I can. It's
different.
different. It's definitely different.
Less pain here when you sit? Or just different?
It's different.
Okay. Head down. Let's change that up for her. Cool. Metabos.
Can we take my glasses off?
Yes, please. Center on the chair for me too.
Center on the chair.
Center up. And this one's gonna be light. Let's start C2. Nice and light. Doo-doo, doo-doo. There it is. Good. Wow. Drop. Left ear down. Wow. Let's pull. There you go. Walk it out there. Times. Well, you can actually see her nipples moving when she walks. They're moving different in the back.
I actually feel it in my leg, my knee.
What do you feel?
It's not as tight.
Cool. So it's like the pulley system at the gym, ma'am. Right? When those pulleys are out of alignment, those cables are working too hard. So we get the pulleys back in alignment. What should happen logically?
They run smoother and they don't get picked up.
Absolutely. Have a seat, please. T7, T8 is clear. Sacrum, doo-doo. Clear. I'm getting a little bit at 5, but I'm not ready. Let's see. No, that's just heat. Okay, that's all clear. Neck is clear. Awesome. That's all clear. Let's do the buff and polish now on the back. You're doing vibration therapy, breaking up scar tissue.
Okay.
And then continue. found them 6 months ago, you said? Or
Probably
just
about.
popped up somewhere?
What is scar tissue made up of?
Ligament. It's all connective tissue. Cross matrix scarring, fibrotic tissue. So when we're looking at fibers, right, typically when fibers tear, joint fibers tear, they tear like this.
Okay.
And there's a correct way to fix that with adjustment, rehab, nutrition to create what we call a plug formation.
Okay.
Plug formation is more like the original tissue. When we leave it and just kind of leave it alone and just take things to mask it, and we don't actually fix the problem, it creates cross matrix scarring. It's this. This is rigid. This is not. Okay? So, cross matrix scarring. So I'm going in there, I'm trying to break up this cross matrix scarring. Does that make sense?
Yeah.
Walk it up, check it out. Now work on your shoulders.
Okay.
Now you tell me. Now your hips are actually
Yeah,
moving up.
I don't feel like I'm swinging.
Correct. Have a seat, let's work on the shoulders, please. And let's not forget the ears. Right shoulder, let me do the work, I'm reaching over. There you go. Let me do the work. There you go, on your back, please.
Head this way.
Yes, ma'am. Sound is the board, not your ankle breaking. And I'm using the board first visit with you. We got a good set there. I don't want to yank on it on your first visit, okay, so to speak. I don't want to do long axis distraction adjustment. Raise your right leg. There you go. Raise your left leg. There you go.
That's painful.
What's that?
The ankles. That was more further than the back.
Seriously?
Yeah.
Go ahead and bring your feet together, bring your toes back. Your left is worse.
Is it?
Yeah, not sure. Your left is more. I'm just starting it right now. Go back and look at some of the foot stuff. I'm gonna have to use lotion, break up scar tissue, and then we have to go a little gangster. Come up slowly, let's walk it out.
Oh, wow.
Wait. Take your time.
I feel that right there. Ooh.
What up?
It's,
You got up?
There's like a spot right on the lower right. That was kind of a sharp.
You know what that is?
What is that?
All right, come back.
Okay.
I gotta do one more thing. So I told you I'm torquing this up.
Yeah.
This thing is pulling it back. Let's go back over here. So I'm torquing this thing up.
Yes.
This thing is pulling it back. So I gotta have a talk with it. Come on. All right. She's gonna love me or hate me right now. BRS. Gotcha.
Don't hate you yet.
Oh no, that was clean. Step away from the vehicle, ma'am.
Maybe. It's pretty. It's sore.
I know. Hold on, hold this. I got you. Oh man. I'm not joking.
Cool. No.
I don't know. Don't want you to test. You're not gonna like me right now. I'm okay with it though. 'Cause that thing moved. She's giving me that eye right now. Oh, nice. Let's recheck, make sure. You're gonna just fine, okay? Just gonna make sure. There you go. Check it out. Back slowly. Tender, less.
It's less than when you did it the first time, for sure. I don't feel the pain anymore.
That's S3.
Uh-huh.
That's S2.
Uh-huh.
That's S1. That's the L5. Now, go back on your back. Because we gotta do that same movement. I gotta make sure she ain't playing with me. Alright?
Yeah.
Now, the way you get up, we're gonna turn to your side and push up. Don't jump up.
Yes.
Okay?
I've been told that before.
That should be a little bit easier. And it's gonna be hot.
It is, I can feel it. It's warm.
I gotta move them. Turn to the side and let's get up this. Turn. And push yourself up.
Ooh.
Alright. And walk it up. So this is a good case, guys. This is a really good case. And through the adjustment, I mean, we got loosened up a bunch of scar tissue. So your most important thing right now is walking, okay?
Mm-hmm.
And what you're gonna do when we're done right now, you're gonna slap an ice pack on, she's gonna give you your enzymes, you're gonna go walk for 15, 20 minutes.
Okay.
You're gonna check in before you leave,
Okay.
okay? It's moving now. You need that movement, though. You definitely need that movement and icing. Cool. She's getting mad dogging me. Your walk is completely different, okay?
I can feel it.
And that you're not used to. You've been like this for a long time.
Mm-hmm.
All right, last time. I'm happy with that. And we can compare that to the first time. Squeeze the hand. Squeeze. Squeeze. Okay, you're gonna go walk. 20 minutes.
Okay.
Ice, enzyme, come back. Check in with me before you leave.
Okay.
Squeeze. You're gonna have soreness.
Yeah, I feel that hard.
You're gonna have, but you're an athlete. You know what soreness is about.
I was an athlete.
Was. It's a mindset. Get back to that mindset, okay? Squeeze. We lost that mindset along the way.
Uh-huh.
Questions for today?
So I'm gonna walk for 15, 20 minutes. I'm icing enzymes, come back, check in with you, and then go home and
Ice, and ice. She'll give you instructions on enzymes and as much movement as you can get. You have access to a pool?
Okay. I don't.
It's okay, but if you do, you'll do better moving in the pool. Be a little easier to move there.
Okay.
But right now, just walk. No
Okay.
gym. And
How long will I have pain, I suppose, is the word? Okay.
We'll know. You'll tell us when you come. Today is Wednesday. We'll be back on Friday. I'll see you Friday, Saturday, okay? And I'd rather have the soreness now in the beginning and get through it.
Okay.
And let's get over this, the first hurdle. Okay, my dear?
Okay, thank you.
Welcome to the office.